Excellent. I'm happy to be sitting here now with Pranav, who I met 3 years ago when we first started work in Ohio. Pranav is an amazing human who has learned harm reduction through putting his feet on the ground and creating all kinds of networks across Ohio, and is specifically involved with harm reduction inside of Ohio State University. And I am thrilled that Pranav is going to be presenting today, and I'm going to stop talking and I'm going to leave. So take it away, Pranav.
Thank you so much, Una. Super excited to present to you all today. Can everyone see the slides? Pretty good. All right, awesome. Hi, everyone. My name is Pranav Padmanabhan. I'm the Executive Director of the SOAR initiative, which is based in Columbus, Ohio. So we're a 501c3 nonprofit. We were founded about 3 years ago. It started as a student project at The Ohio State University. So the story behind us is we were a group of 6 undergraduates 3 years ago. That was when I was a freshman. I'm currently a senior. And we had heard of someone overdosing on fentanyl-laced cocaine at a campus area bar. And this was when we were all fresh out of high school in university, and this was sort of really shocking. I grew up in Youngstown, Ohio, which is one of the epicenters of the overdose crisis. So this issue had always been around me, but it had never affected me so closely and profoundly as it did when I was a freshman. This was, within walking distance of my dorm. So we decided that we wanted to do something. We wanted to prevent things like this from happening in the future. We had noticed that the university and the city in general, we felt wasn't doing enough to educate people about harm reduction and the dangers of fentanyl-laced drugs in the supply. So we founded this organization. So initially, we focused our efforts just on Ohio State's campus. So one thing that we had learned about was fentanyl test strips. And 3 years ago, this was relatively new in Ohio. There were a lot of activists who were giving out fentanyl test strips around the city, but there were no formally sanctioned programs where people could obtain fentanyl test strips, except for one program through the city health department, which partnered with a local head shop. And even there, fentanyl test strips were super inaccessible. They didn't get consistent funding, and no one knew about them. So we raised some money to get some fentanyl test strips to give out to students on campus and in the surrounding areas. And we also volunteered at SafePoint, which is the syringe exchange in Columbus. So when we were at SafePoint, we were talking to a lot of the clients there, and they were also repeatedly mentioning that fentanyl test strips were in need. And then another thing that we heard was that people who use drugs and activists had really extensive knowledge of the drug supply. So people were sort of informally warning each other, like, hey, I tested this batch of cocaine last week that tested positive for fentanyl, or watch out for this pill that's blue and has this certain marking on it that's being sold as oxy, but it's actually fentanyl. So things like that. So there was this really extensive network of information that people had, but the public health agencies in the city were completely unaware of this and were not really embracing a harm reduction mindset. So that's where we started. We're currently up to 15 employees. Most of us are students and a couple of recent graduates. So the first sort of major program that we launched was something that we called Strip Club, and we're really proud of this program. It's the first mail order harm reduction organization in the state. So this is a form on our website that anyone in the state of Ohio can go to and request 5 free fentanyl test strips shipped directly to their address. And these come in discrete envelopes. People can choose whether or not we have a return address or not. and the only information that we ask for is people's address. So we wanted this to be as barrier-free as possible and as accessible as possible. And this form is for personal use, so people can order 5 fentanyl test strips for personal use. If you are a harm reduction organization, you can request larger numbers of fentanyl test strips as well as other supplies like syringes, Band-Aids, alcohol wipes, things like that. And then the other major program that we launched is an overdose surge alert system. So this was inspired by other systems that we had heard in Baltimore and Vancouver, where they have a bad dope alert system. So this is an anonymous text line where anyone can sign up to receive texts whenever we get information from the coroner's office or the health department that there's an overdose surge in a particular neighborhood, and we can send those out via text. So we launched this in September of 2020, and this was still when COVID was really, really rampant in Ohio. So this was a way that people could receive information in a time, especially when everyone was isolated and didn't have access to things like syringe exchanges. In addition to just sending out overdose surge alerts, we also recognize the potential of crowdsourcing data. Like I said, at SafePoint, we heard a lot about the information that people had about certain drugs that were laced with fentanyl. And these statistics are from Harm Reduction Ohio. You can see the percentages of each drug in 2020 that were seized that contained fentanyl. So sort of the model we came up with is if we can gather data from the public and sort of integrate that with the data that we were already getting from the health department and the coroner's office, we could potentially predict and prevent overdose surges before they happen by figuring out where these bad drugs were going to and getting the resources to those neighborhoods before there was an overdose surge. So this is just a model of how our deadly batch alert system works. So it's a two-way text alert system. So in addition to people receiving overdose surge texts, they can also text back. And we ask for the name of the drug if people know like what it was sold as, and if they tested it and it tested positive for fentanyl, or if they have any other information about it, like if they knew friends that had a bad reaction to it. And we combine these reports with data and send texts back to people in particular counties or neighborhoods that were being affected. And then finally, putting all of these resources that we have together, we are currently developing an app that is meant to be used statewide, that combines the ability to receive overdose surge and deadly batch alerts, submit your own anonymous reports of deadly drugs, as well as have access to links to order Narcan and fentanyl test strips for free, as well as a page for resources near you. So we soft launched this just in the central Ohio area in December. We had a couple focus groups where we got feedback from the public and are currently improving it and are hoping to launch it statewide this spring. Now, this is a flyer that we hand out when we do outreach. So we have teams that do outreach at syringe exchanges, college campuses, bars, any other site where people could use Narcan or fentanyl test strips. And we also partner with other harm reduction grassroots organizations around the state to spread the word of our deadly batch alert system. So this is for Central Ohio, which was the first one that we launched. And since then, we've had similar alert systems in 5 other regions throughout Ohio. And our goal is to create a replicable model that any region across the world could really use. So once again, we really try to focus on community helping community. So as we're students, we really see ourselves not at the forefront of harm reduction. Our goal really is to support the work that has been done and it is being done by people on the ground who know these communities like the back of their hands. And we're really trying to empower them to spread the word about information that could be useful to those communities. So it's a totally anonymous system. We don't work with law enforcement of any kind. anyone can sign up for the system. We have sent 30+ deadly batch alerts, which are alerts that were generated from information submitted from the public since September 2020. And in addition to those deadly batch alerts, we have also sent 40 to 50 overdose surge alerts that are from EMS data and coroner data. And the next steps that we're looking at are integrating data from drug checking machines. So we know that this is an innovation that some areas are starting to embrace. So as harm reduction advances, we're looking to get that data as well and use it. In addition to that, we're looking to do some more in-depth geographic analyses, so we can potentially predict when a particular surge is reaching a neighborhood before it's even there. And this is based on data from drug markets. Expanding the reach of our alert systems. So right now we have these 6 systems. Each one is a different phone number that you can receive and send alerts from. So we're hoping to get in touch with additional counties, get plugged into their data systems, and launch the system in their regions as well. Building community. So a large part of why the system works is because of the trust of the community. It wouldn't really work otherwise. So we're constantly looking to build bridges and meet people that the system could potentially be helpful for, and spreading the word. All right, so that's a quick overview of our deadly batch alert system. I'd be happy to take any questions.
Awesome. I'm coming in. Hi. Thank you so much, Pranav. Before I get, there are a couple questions in the chat, but I also wanted to state one of the reasons that I was so impressed with the work that you folks are doing is that you inadvertently built a platform which does not use law enforcement or inform law enforcement. And you did that because you were mainly concerned, and your motivations were to get real-time information from the experts, the people who use drugs in the field, with other people who are using drugs, as well as the services that are connected to them. So for those of you who don't know, ODMAP, for example, is used primarily by policing bodies to further criminalize and to heighten police activity in areas where drug overdoses are happening. And its secondary purpose is that it has been shared as having utility for service providers inside of that space, but its primary purpose is to get policing bodies into what they see as criminal activity. So an app that gives drug users information that doesn't put drug users at risk of criminality is what I saw as like the brilliance of what it is that you are doing. And yeah, my hat is off to you. You've come a long way in the past many years. Yeah. All right, so moving on to the questions. There's a question from Sampath. How do you handle the logistics on the back end for strip delivery service? And do you have, so there's 2 questions. We'll just start with the one. How do you handle the logistics on the back end?
Yeah, that's a great question. So we have someone on our team who's the project manager for Strip Club. So she's fantastic. She works part-time, just making sure that we have supplies available. So we use Nason as our provider for all the harm reduction supplies that we ship. So she's the one handling the orders there. And we also have a team of volunteers who actually do the packaging. And when we don't do the packaging, our project manager does all that herself. And we're able to ship over 95% of our orders within 2 weeks after they're ordered. So we're pretty proud of that. We launched the service was just over 9 months ago. So that program has really been a source of pride for us, and I think it's helped a lot of people.
Amazing. So that leads into that next question. Do you have full-time staff volunteers? I think you might have already answered that, but maybe just give it a quick.
Yeah, so we have probably about 4 or 5 consistent volunteers. We were just able to get an office where we could store all of our supplies, and people could come in and ship the boxes. So that has really been helpful for us.
Amazing. One more question. Did you have struggles getting the App Store Play Store approval for your app?
We actually didn't, which was kind of a surprise for us. So, a concern that we always have is, so we are shipping drug paraphernalia, and the laws have changed a lot even over the past couple of years that we've been active in Ohio. We just heard that we're now able to use federal funding to buy test strips in Ohio, which is a pretty big deal for us. So that has been really helpful. So, with that concern about the drug paraphernalia laws, we were always concerned that we would run into issues with the App Store, but they've really not had any issue with anything that we do. I don't know if that's because they don't really know what we're doing. That might be it, but we're not complaining.
Excellent. Have you had any pressures from law enforcement to share information?
Yeah, we have. So I would say this is more so in the rural areas, the rural counties in Ohio that we work with. And another sort of issue is the culture of even like health departments in Ohio, at least, is very much that health departments and law enforcement work together, and they're almost like one agency, and just two different wings of the same agency. So more so than I think law enforcement directly sort of pressuring us to share data, we always have to be wary that our connections with health departments themselves can sort of jeopardize our relationship with people who use drugs. So that has been a challenge. So the way we've navigated that is really, I think, just being upfront about like what data we get from health departments, what data we send out. We don't send any of the data that we get from the community to health departments. We don't share that with anyone. So that has been really helpful for us to build trust. So everything is just aggregated, and people have the ability to choose what information to share with us. They can say whether the drug was purchased at intersection level or zip code or neighborhood. So also giving the people who are reporting the data the ability to determine exactly what data they want to share.
Yeah, we get asked for data all the time too. Like, no, you can't have it. Okay, last question for Pranav. What are the startup costs for your app? By the way, they're from Sharon, Pennsylvania, your Y-Town neighbor.
Yeah, Sharon's like 15 minutes from my house. That's great. So the startup costs for the app, so we have a team of student developers. So we have 4 students, and actually the app originally started at a hackathon at Ohio State. So we got the bulk of the infrastructure built up basically for free. It was a student project. So that really helped a lot. And we were really fortunate to get initial funding from Columbus Public Health. So in 2019, they reached out to us sort of out of the blue saying, we heard about this project that you're working on, and we want to help you guys out. And here's basically all you need to build the app. So that was really good for us because we were actually able to pay our student developers at that point. And then after that, maintaining it we've just used funding from other sources. The state of Ohio has actually been really helpful for us in obtaining funding. Yeah, it's been pretty smooth sailing from there.
Amazing. Pranav, we need to meet. We need to talk. I'm so excited. All right. Thank you so much for joining us. Suzanne, lovely Suzanne. Hi out there.
Thanks, Suzanne. Love you.
And says that you're awesome. And Casey, such great work. Keep it up. Excellent. We are going to take one moment. I'm going to run backstage and get our next presenter up and running. And we will see you in 1 minute.